Okay, so I think we covered CVA. So AVMs, arteriovenous malformations. These are developmental abnormalities that patients are born with, where the arteries are connected to the veins by this abnormal thin-walled vessel that are larger than capillaries. So it's almost like a web of where the arteries and veins are very close together, and then when they rupture, we have a mix of blood, and usually the folks with AVMs don't have any symptoms until they rupture, and then it causes this hemorrhage, and then it's essentially like a stroke. Sometimes these AVMs are found if a patient has a brain scan looking for something else. They may be having a scan because of other symptoms that they're having unrelated to the AVM, and then the medical team find an AVM. I had one of my youngest patients who had an AVM was a high school hockey player who was playing hockey one night. I think it was a game, and he just collapsed on the ice, and he didn't have any. I don't believe there was an impact, but all of a sudden, an AVM that he had in his brain that he didn't know about blew, and he became my stroke patient. He was like 16, and sometimes with folks with an AVM, they have multiple AVMs, depending on their abnormality. And, it's kind of like waiting for the next, once you have an AVM and then you find that you have several AVMs, it can be a little scary because they may all blow. And you're kind of walking around with this knowledge. So AVMs are a part of this vascular one kind of disorder of the vascular system. Aneurysms are another, and that's when a wall of the artery or vein is dilated. There's a picture on the right. So the walls of an aneurysm are become really thin because they're dilated and stretched, and they're prone to rupturing. And the rupture can be massive and can cause sudden death. Particularly abdominal aortic aneurysms, so aneurysms that happen in the aorta, in the abdomen, where the aorta is really big, and if you have this big aneurysm there, of course those are not in the brain, but just aneurysms in general are artery or veins that have been like dilated and stretched out, and so therefore the walls are thin and more likely to rupture. So those are some of the disorders of the vascular system. And again, whether it's a TIA or a CVA or an AVM or an aneurysm, they can vary depending on their location. They can vary depending on how big they are. Some are easier to treat, like you may go in and be able to surgically repair an AVM if you find it. Some aneurysms are easier to surgically repair than others, depending on their location. Right, so the medical team is going to have to decide how severe is this vascular injury. Can I get in there, or am I going to cause more damage going in to surgically repair it, so to speak? So those are the types of conversations and questions that the medical team has to face when they're talking about some of these vascular issues. So how do we study those vascular issues? So the medical team has a couple different things that they can do. The top one is a PET scan, and it's a positron emission tomography, and it's a computer-generated image, and it's based on the metabolism of an injected radioactive dye, and they tend to put in this radioactive dye, and then the radioactive dye travels through the body, and it's taking a look at blood flow. So which areas of the body or the brain are having increased blood flow. And that can tell whether there's increased cellular activity like a tumor, That can tell you if there is increased neural activity in certain areas. So that's what a PET scan can do, and you can see that on the right. We can also do MRAs, which are magnetic resonance angiography, which is a study of the vessels, a different study of the vessels. So with an angiogram, a dye is injected into a large artery with a catheter. They often use the femoral artery of the leg because it's big. And then they take X-rays, and the vessels start to light up. So the medical team can visualize things like an aneurysm, an occlusion, an AVM. So this kind of angiogram is a study of the vessels and their integrity. But of course, we're looking at angiograms because we think there's a problem with your vessels, right? Or we wouldn't be doing an angiogram. So, of course, a lot of the folks who have problems with their vessels have atherosclerosis in their vessels, hardening plaques that are making the vessels more narrow. And so these plaques could become clots or thrombi in the arteries. So these invasive procedures do have risks with them, because if you are sticking a catheter into somebody's vessel and you hit, a plaque and you dislodge it and it becomes a blood clot or an embolus that travels elsewhere, so there are risks to some of these studies as well. But again, the question is, how badly do we need to look at that angiogram, at the integrity of the vessel? So again, back to the blood-brain barrier. So again, that blood-brain barrier is so critical to the health and safety of the brain. The barrier isolates the central nervous system's neural tissue from the general circulation of the body, because a lot of things can be floating around in that general circulation, right? So there are a couple components, a couple things that weigh in on that blood-brain barrier. So the first one are during the regular capillaries of the brain, we had these endothelial cells and their tight junctions. Those tight junctions prevent diffusion between the endothelial cells. So it forces those substances to go through the cell rather than between the endothelial cells. Only lipid-soluble compounds like CO2, oxygen, lipids like steroids, prostaglandins, small alcohols, ammonia can diffuse through the endothelial cells. Other things like water and ions must pass through certain channels, and the larger water-soluble compounds can cross the capillary walls only by active or passive transport. And remember our friends, the astrocytes, they also play a part in this blood-brain barrier. So let's take a look at the blood-brain barrier. Again, you could see the endothelial cells of the capillaries in the cerebral, in the brain, and they have these tight junctions. And those tight junctions, meaning they're really closely held together. And those tight junctions between them exclude larger molecules and prevent many pathogens, toxins from entering the nervous system, the blood in the brain. We also can see that purple astrocyte. The astrocytes also contribute to the blood-brain barrier by pressing against the capillaries and releasing chemicals that help control permeability and only allow certain substances to cross. Where's my thing? Hold on. There it is.